Welcome to the healthaibrief, breaking down the AI shaping our world one concept at a time. Last time we established that the fundamental goal of training an AI model is to minimize error, but that begs a crucial question: how does the model actually know how wrong it is? If a model predicts a 90% chance of pneumonia from a chest x-ray and the patient turns out to be clear, how does it quantify the scale of that mistake? Is it just a simple wrong or right, or is there more to it? Getting this right is everything. The way we choose the measure of error fundamentally shapes how the model learns and what it prioritizes, and the tool for this job is called the loss function. Think of a loss function as a senior registrar marking a junior colleague's attempt at interpreting an ECG. The registrar doesn't just say pass or fail, they provide a kind of more nuanced score. Misidentifying a bit of artifact as a P-wave is a minor error. Missing a STEMI entirely is a catastrophic one. The registrar's marking scheme, as it were, the set of rules they use to assign a penalty score to different mistakes, is that loss function. It's a mathematical formula that takes the model's prediction and the true outcome and spits out a single number representing the cost or loss of that error. A big number means a big mistake, a small number means the model's getting close. The entire learning process we talked about, the cycle of predicting, checking and adjusting, is driven by the model trying to make this loss score as low as possible. But here's a critical part: there isn't just one universal loss function, there's many different types, each one penalising different kinds of errors in different ways. For example, one type of loss function might give a huge penalty for a false negative, missing a cancer diagnosis say, but a much smaller penalty for a false positive. Another might be designed to punish predictions that are confidently wrong more severely than those that are uncertain. The choice of loss function is a decision made by the researchers, and it directly reflects the clinical priorities of the problem they're trying to solve. So why does this matter for our clinical practice? Because when you read any AI paper, the loss function is one of the most clinically relevant details in the entire methodology section. It tells you exactly what the researchers told the model to care about. It gives you three powerful questions to ask. First, do the authors even state what loss function they used? If they don't, that's a significant red flag regarding the paper's transparency and rigour. Second, does their choice of loss function make clinical sense? If they're building a cancer screening tool, did they choose a function that heavily penalises missing a diagnosis? Their choice reveals the clinical priorities that will result. And third, could a different loss function have resulted in a more clinically useful tool? It prompts you to think more critically about whether the model's objective truly aligns with the best outcome for the patient. So that's loss functions in a nutshell. It's not just a piece of mathematical jargon, it's the rulebook that AIs use to learn, and understanding it's really important for judging the clinical credibility of any AI model.